Today we will be reviewing the home exercise program for patients following reverse shoulder arthroplasty with the help of one of our occupational therapists. The first set of exercises we will show you are to begin on the day after surgery and will continue for 3 weeks.
So prior to completing your exercises, you obviously want to take your sling off. So while you're still standing next to whatever surface that you're going to lay down, you want to start with unclipping the seatbelt or the pillow bolster right at the waist. And then the next step is you want to undo these 2 Velcros, the one Velcro near your elbow and the one between your thumb and your first finger. And then the last step will be undoing your strap over your opposite shoulder. And then if you want to lean forward a little to take this bolster out, and then have a seat on the surface that you'll be doing your exercises. Okay, so 3 times a day you want to complete your elbow, wrist, and your hand exercises. We'll start with the exercises you can complete sitting down. So the first exercise will be for your wrist. You want to bend your wrist forward and then straighten it out and back away from you. So you'll go ahead and bend towards you and then back away from you, and you want to do this 10 times. If you need to help with the other hand, you can help with the other hand. If you need to rest on a pillow, you can always rest your hand on the pillow and then complete it if you need to support your arm. After you're finished doing 10 of these, the next exercise will be rotating ulnar deviation and radial deviation. So you can just do this right on the pillow if you want to, just back and forth along the pillow. If you're comfortable enough, you can kind of do it right down at your side. After completing 10 of these, the next one you will do is just for your fingers to help with swelling. You want to make a tight fist and then straighten your fingers all the way out. And then you want to make sure to do this 10 times nice and slowly. This exercise you want to complete more than 3 times a day. If you can, try to complete this once an hour just to help with the swelling in your hand. And then the last exercise, we'll go ahead and take this pillow out. It might be a little bit easier if you stand up for this exercise. And then you just want to go ahead and then straighten your elbow as much as you can and then bend it back up. And for this exercise, you might need to help with the other hand at the wrist to just kind of bend it up a little bit more. And make sure you're getting your elbow all the way straight. Good. And then after completing 10 of these, then you're finished with all of your exercises.
You will begin the next exercise 3 weeks after surgery. You will be told to start this exercise after your follow-up appointment.
So for this next exercise, what you'll be doing is shoulder flexion, helping with your other hand. So what you'll do to start is you're going to clasp your hands right in the center, kind of near your belly button, and then you want to straighten your elbows out a little bit more before beginning. At this point is when you can start to bring your arms up over your head. Keep going until you feel a stretch, and then you want to hold it where you feel the stretch. Come on back down. And we want to continue to do at least 10 of these. And then each time you want to try to go a little bit further over your head and make sure you're holding at the end for that stretch. A little bit further and then hold. And then bring back down all the way to the belly button. It might be helpful to start with a pillow beneath this arm just to have a little bit more support.
The final exercise that we will demonstrate today begins 6 weeks after surgery.
So for this exercise, we will be reviewing how to strengthen what we call your anterior deltoid. So you will start by having something like a soup can, something that weighs around 1 pound that you're going to place in your hand, in the palm of your hand. You'll grasp it so that your thumb is facing up. You're going to place this in the operated arm, and then you're going to start with your elbow straight next to you, and then with your thumb up, you're going to go ahead and bring your arm towards over your head. bring back down to your side for one full repetition. So you can choose to use a soup can, you can choose to use, you can get a weight from the dollar store, that's 1 pound. Just make sure that you're just using the 1 pound limit for right now. Go ahead and bring all the way down.
This concludes our video tutorial. Please call the office with any specific questions regarding your post-operative exercises.